Hi, I'm Dr. Wilshire at Missouri Fertility. Welcome to our Ask the Expert series. Today our expert is Dr. Erica Bove. Welcome to the show, Erica.
Thanks, Dr. Wilshire. It's so great to be here.
Thanks for sharing your time with us today. I would like to talk to you about a broad topic called optimizing natural fertility. There's so much that goes into conception. For couples that aren't having any problem, it's like breathing. Sleep together, get pregnant, it's no big deal. And for some people, they do this and pregnancy is not forthcoming. So can you give us your thoughts on this enormous topic of optimizing natural fertility before you have to come to a doctor like us?
Absolutely. So I think it's really important that, there's the male component and the female component, because I think a lot of this often falls on the woman. There's a lot of biological reasons that make sense, but I think it's
fair.
It's not there, but it is what it is. I mean, we have to acknowledge that, we need good eggs, good sperm, and we need good anatomy to make it all happen, right? And we need healthy habits to optimize the chances of conception. What I like to say is, we are very inefficient as human beings, like to start. Those people who get pregnant, all of a sudden, that's kind of a miracle, because even at our peak fertility, we get pregnant about 20% of the time, right? And so if that's the best it ever gets, and we have habits that may be impairing those sort of processes, then it's even worse than that. And, throw in a little bit of advanced age in there, it can be really hard to overcome sometimes. So when I love the fact that I get time to see a new patient, a new couple, and I get to ask them, first of all, like, who are you? What are your goals? How many kids do you want? Where are you from? How do you spend all those things matter, how you spend your free time. And then we can get into the medical history of is there any thing that raises an eyebrow that might, propose a struggle. But then really the social component, okay, what things do you put inside your body? I'll tell you, I'm in Vermont where at least 40% of my patients regularly smoke marijuana.
Sure.
It's very much the culture in Vermont. However, I tell my patients, I'm like, listen, the sperm are stoned. You don't want stoned sperm, that sort of resonates with them.
Yeah.
And you can see it on the semen analysis. They're swimming in circles. And so, I try to find ways to kind of explain to patients, we're very inefficient. So if in addition we're putting toxic chemicals from cigarette smoking, or chewing tobacco is a really bad one.
Yes, chewing tobacco, greatly underappreciated problem.
Underappreciated. In some ways, I looked at the data a couple of years ago. It's worse than cigarette smoking. And, in marijuana, even CBD, it's I'm not, smoking marijuana, but even CBD has been shown in several studies to be harmful. That's sort of one opportunity. Gosh, there's so much we can't control. But it's not easy, but if we can control getting those things out of the habits of the body, obviously we have to replace them with something too, if that's sort of been habitual, but really being pure about making the body as healthy as possible. That's really important. Similarly, I love talking about sort of diet and exercise and sleep, and really kind of not to become obsessed with those things, but to say am I living my most fertile life such that, as a pregnant person, as a new mom, this would be a good environment for a baby, right?
Yeah.
Overweight, underweight, eating junk food, although not sleeping very well, too much caffeine, all those things really matter. And so really looking holistically at somebody's life, even stress. Again, we don't, stress is not to blame ourselves, but to say is there anything I can do to make myself feel better? And to overcome this stressful experience. And so looking at those things, making necessary changes one at a time, and then allowing the science to work.
Yeah. So I see mixed reviews on people doing apps and whatnot to see, when is their fertile window and stuff.
Yeah.
Are there any general signs or things a person can be aware of, a couple can be aware of, to suggest maybe there's an underlying problem here and maybe I should see a doctor sooner than later?
Yeah, sure. So, I see people in all sorts of situations. If I see a patient and she is the common denominator of the infertility, so meaning, she's had maybe her first husband, she was unable to get pregnant with him, but subsequently he's had 2 children, and she's currently struggling in her current relationship, although he has a child as well. That's sort of like, okay, maybe we need to sort of think about that, a little bit in more detail. So that's sort of something historically that always gets my attention. And then also, like, does somebody have any risk factors that would make this more unlikely? So say, the periods are very irregular. Like, that probably suggests that somebody's not getting a fair shot every month at trying. And so maybe see a fertility specialist on the sooner side. If somebody has a history that, sort of would increase risk factors for the tubes, the fallopian tubes, which are those connections between the uterus and the ovaries. That's right. I love those fingers. If those are blocked, then we want to know about on the sooner side. So if somebody's had a lot of like abdominal surgeries, or if they've had a history of sexually transmitted infections or other problems, it's go see the doctor on the sooner side. Don't try and just wonder, but go get that information sooner. And those are the things, like, a lot of, actually, I wanted to mention this too. A lot of men are taking testosterone supplements.
I had one yesterday.
I know.
Couldn't understand. It's like, dude, you've been on testosterone pellets for 2 years.
I know. So, I mean, the point
is
My
doctor never told me. Well, a lot of doctors don't know that kills sperm.
I know. And so it's, being on testosterone supplements kills the body's sperm count. And it's people even doctors don't know this. And so, I think people are surprised to learn that if they're on these things, they don't have any sperm. I mean, the sad part is sometimes it's reversible and sometimes it isn't. It usually is, but not always. And so.
And it takes time.
It takes time.
It doesn't get better tomorrow.
Yeah. So that's something that is really important to think about. And then, just helping people understand their bodies. And so there is this thing called the fertile window. I think about, to help people understand, I think about a traditional male-female wedding where, the groom is waiting for the bride, right? So sperm lasts a lot longer than the egg. The sperm lasts about 2 to 3 days in the female body, maybe even up to 5 days or even longer. And the egg, we think, lasts maybe 12 to 24 hours once it's ovulated. So, we want the sperm waiting for the egg. That's sort of the point. And so I tell my patients, if they're having intercourse, about every 2 to 3 days, there should always be sperm there, and not to get too hung up on the timeline, because then, sex becomes work, and then that's sort of counterproductive.
Right. If they're forcing it, that's why the advice kind of has to be tailored to the couple a little bit. For some people, they're 17, they're enjoying it every day is fine. It's not work. When you get older, you got a job, you got other kids, responsibility. It's like, oh my God, I have to have sex tonight, when really it's not necessarily helpful.
Yeah.
It can be harmful. You're describing.
Yeah, exactly. So I think you're right. Tailoring it to the couple in front of you, and really just understanding who they are, what they value, what their goals are, what their lifestyle is, and then putting it all together. Yeah,
they might need some sleep.
They might need some sleep.
And not drive back and forth if they work far apart. Yeah. So I guess I'll just top this off with my bias here. There's a definition of infertility, which says you've been trying for a year if you're under 35. And I have patients all the time say, I said, why did it take so long? I said, my doctor said I have to keep trying, when in fact there were signs that they had a really big problem, like you mentioned earlier. And I am not a slave to this definition, right? If you think there's a problem, go see an expert like Dr. Bove before you waste time, because time is our most valuable asset.
Yeah, and you too. I mean, for all your listeners, if you're listening to this and you're like, oh, wow, I was hospitalized at the age of 20 for that pelvic infection, and I wonder, just go to Dr. Wilshire. He'll sort you out, I promise.
Yeah, and I had that appendicitis. People don't realize that ruptured appendix or that appendicitis can also harm the tubes.
That's right.
Well, Erica, what fantastic advice. I love how you even talk about inefficiency. I use the same words that I do. We're very inefficient at this, but with a little luck and some hard work, hopefully everyone can be successful.
That's right.
So, Erica, thank you again for your expertise and your time today.
Thank you so much.